And this has been heartbreaking every day. 226 deaths, 226 families. And you see how that number has been infuriatingly constant. 226 is where we were 5 days ago. So we would like to see that number dropping at a far faster rate than it has been dropping. And these are 226 people who lost their lives despite everything our healthcare system could do, right? That's despite the best hospital care, the best nursing, the best doctors, the best equipment. So they are people who we know we made every effort possible to save. And to the extent there's some peace in that, then we're looking for peace wherever we can. Priority for us today is dealing with a new issue that has come up, which is truly disturbing. And that is the issue on how the COVID virus may affect young people, very young people, infants, children in elementary school. We had thought initially, and again, so many of what the initial information we had turned out not to be correct or turned out to be modified. But we were laboring under the impression that young people were not affected by COVID-19. And that was actually good news, right? The vulnerable populations were older people, people with comorbidities. But one of the few rays of good news was young people weren't affected. We're not so sure that that is the fact anymore. Toddler, elementary school children are presenting symptoms similar to Kawasaki disease or toxic shock-like syndrome. Now, these are children who come in who don't present the symptoms that we normally are familiar with COVID. It's not a respiratory illness. They're not in respiratory distress. And I think that's one of the reasons why this may be getting discovered this far into the process. It's more an inflammation of the blood vessels, which can then cause problems with their heart. And there are 73 cases that the Department of Health, Dr. Zucker, is now studying. But the illness has taken the lives of 3 young New Yorkers. So this is new, and it's developing. The Department of Health has communicated with the federal officials, the CDC, and the CDC has asked New York to develop national criteria for this so that other states, other hospital systems can also be checking into this and looking into this. Again, as it turns out, these children happen to have the COVID antibodies or be positive for COVID, but those were not the symptoms they showed when they came in to the hospital system. So it's still very much a situation that is developing, but it is a serious situation. The Department of Health is also going to be working with the New York Genome Center and Rockefeller University to conduct a genome and RNA sequencing study to see if there's something about these children that may present a definable situation. But rest assured, the Department of Health is on top of it. This is the last thing that we need at this time with all that's going on, with all the anxiety we have. Now, for parents to have to worry about whether or not their youngster was infected. And again, symptoms that don't even seem like the symptoms we associate with COVID-19. So we still have a lot to learn about this virus. And every day is another eye-opening situation. But rest assured, the Department of Health is doing everything that they can do. I think it's fair to say that the New York State Department of Health is the first one that has been on this situation. And again, working with the CDC, and whatever we find out, we'll not only share with the public, but we'll also share with other states and other hospital systems. Because it is very possible that this has been going on for several weeks, and it hasn't been diagnosed as related to COVID. So again, we'll keep you updated. I know many people are concerned about that, as they should be. A priority that we've been working on throughout has been protecting our frontline workers. We're very aware of the sacrifices that our frontline workers are making, so many of us can stay home and stay safe. And we want to make sure we're doing everything we can to protect our frontline workers. We've been working with the healthcare workers, police officers, firefighters, EMT, and our transit workers. In New York, we have to keep the public transit system operating. That's how many essential workers, frontline workers, get to work. If we got to a situation where we had to close down public transit, our hospital system would have suffered. That's how nurses get there. That's how the hospital staff gets there. But our transit workers had to operate that transit system right in the midst of this COVID virus, and it never stopped. Bus operators, train operators, the station cleaners. So while everyone was trying to get home, trying to stay safe, they were showing up for work every day to make sure that the people who did need to go to work could get to work. We've already conducted the largest antibody test in the country, 15,000 people in that sample. What the antibody test tells you is who has been